Welcome to Cancer Explained with Central Care Cancer Center. It's likely that someone you know has been diagnosed with a form of cancer. Learn more about specific cancers, their risks, signs, symptoms, and treatment options by listening to Cancer Explained.
Hello and welcome to Cancer Explained with Central Care Cancer Center. My name is Leanne Powers. I'm the Marketing Director for Central Care, and with me today is radiation oncologist and President of Central Care, Dr. Perez-Tamayo. You know, cancer has no schedule, no timetable. So when you hear that you or a loved one has been diagnosed with cancer, it can be quite overwhelming. Immediately, though, questions might flood your mind, especially the question of why. Well, this discussion is part 2 that centers around some of the most common questions asked, answered, and even some misconceptions about cancer treatments and outcomes. In our first discussion, we talked about getting a second opinion upon diagnosis, what the difference between a PET, a CT, and an MRI are. We talked about immunotherapy, genetic screening, about sugar and cancer cells, surgery and cancer cell spread, and more. Dr. Perez-Tamayo, I thought we might start with this part 2 discussion with clinical trials and the benefits maybe of taking part of a clinical trial. That's something that Central Care offers in their clinics as well when it comes to cancers.
Absolutely, Leanne. People don't sometimes understand what clinical trials are, and they can answer many things. Sometimes the clinical trials are because we've exhausted all the standards of care that are available, and there may be some drugs that are promising to treat your cancer that you may want to try, but they are in a trial format, which means that you will get maybe the medication or you may not get the medication. So it's a randomized trial. Now, I see many people going to large institutions like MD Anderson where they're going to go participate in a trial, and they don't understand that the trial may be a phase 1, phase 2, or phase 3. It is important to ask what phase it is because some of they don't understand that phase 1 and phase 2 trials are not about your cancer. Phase 1 and phase 2 trials are about toxicity of the medication. So you are participating to see how toxic the medication and how high they can go on this medication, but it has nothing to do with response to your cancer.
Wow.
Well, phase 3 is a drug that has been known to be impactful in your cancer, but they may want to put it opposed to, let's say, the East Coast says that this medication is better than this medication. So that is, both medications are effective against your cancer, but not a phase 2 or phase 1. So going all the way to MD Anderson for a toxicity trial may be very valuable, and maybe you want to participate because you have that type of interest to contribute to humanity. But it is not for you.
So you said too, if they go clear, to MD Anderson or whatever, we could even like the same trials that they are doing, but not to that level of...
We do not do any phase 1 and phase 2 trials.
Right.
KU does phase 1 and phase 2 trials. We do phase 3 trials. And that's because we are not interested in toxicity studies at this point. We're interested in studies that are going to be directed to the cancer and the benefit of survival of that medication to the patient.
And it's primarily, of course, chemo drugs that we're talking about, that these
they
clinical
all
trials.
Are chemo drugs. And here again, people are using chemo drug in a loose fashion. Chemo drug can represent many things. It can represent actual chemotherapy, which means drugs that are formed with chemicals. Okay, so any aspirin, and aspirin is a chemotherapy. Okay. Or it can also represent immunotherapy, meaning like a vaccination, like something that is going to be specifically targeted to your cancer, like a vaccine or antibody, meaning against this body that is not yours or antigen. And then 3, it could be hormonal. It could be like something that will be fighting it through a hormonal or a receptor. Like if you can imagine one of those toys that has a star and a round circle and a square, and you put the ball or the square in it, those are receptors. So the cells have receptors in them, and you can turn off and on the cell's growth by fitting these round or square shapes into them and turning them off. And therefore the cancer dies because it's turned off. So these are phase 3 trials. So some people are doing these heroic driving situations without really knowing what they're getting into. Now we do have the trials. We have the ability to, if you participate in them, you have to have certain criteria. So you have to meet those criteria
first in order to, just
Yes.
because technology is continuing to change and new drugs, it seems like, are out there. Is that correct? And
Well, it's not only that, it has to be a team. For instance, let me give you a for instance. If you have a renal cancer and if you have involvement of the gland right on top of the kidney, it's called the adrenal gland, and they remove it, you are no longer able to participate in the protocol.
I see.
So if you don't tell, and maybe the adrenal gland is not involved, if you don't tell the surgeon this person is interested in this protocol, before the surgery happens, you may not be able to participate with that drug.
And again, this all just goes to benefit whether, this clinical trial could end up benefiting more people that have a similar cancer to what you're taking that clinical trial drug for.
Well, it's about teamwork. So if you see someone, that is going to treat you, they need to have the chart and the doctors that are going to participate you right within the diagnostic part and the treatment part. All of the doctors have to be talking.
Yeah.
Otherwise, it's not going to work.
Not at all. Let's talk about overall health and stress. That's something that we, in the openings that I talk about in with Cancer Explained, about how we're trying to always reduce your level of stress when you're, treating or undergoing cancer treatments, because it is just a better component for you. But that overall attitude and being diagnosed with cancer, undergoing treatments, I know we take pride in the local support groups that we are a part of, and foundations, to help our cancer patients. But it also is a very hard thing to overcome, I think, is the stress that cancer plays a part of.
Well, Leanne, I can't imagine anybody that has been diagnosed with cancer not to have stress. It is part of just the word. It's very scary. But actually, the stress started even before the cancer was diagnosed. I have many patients that have been under chronic stress, like they've been taking care of an infirmed maybe parent or a child, or their house has burned down, or they've gone through a very difficult divorce, and this stress has kind of put their guard down. So this is I see it often in women with breast cancer. They always have a story that has been going on for a couple of years at a minimum, if not more, when then basically their body has not paid attention to take care of something that was growing in their breast. And because we're constantly making cancer, all of us, but our body has a police system that takes care of the cancer before it starts. So this is one. The second thing is that when you have stress, you've been already diagnosed with cancer. This has been written in many, many papers. You then have a war that you are fighting in the cancer arena, but then you're also fighting another war with the stress and depression that happens. And then the body will absolutely be taking care of the stress and depression first before it takes care of your cancer. There's a study which is very interesting that is also not necessarily related to stress, but maybe to food and stress, where they took Japanese women, which have a much lower risk than American women of breast cancer, and they followed them after they immigrated to California. And the risk of these Japanese women went up to the American level to 1 out of 7 because they started to have a much more stressful life. The food was different. It was more processed. And now, instead of having, 1 out of 10, their risk went up to 1 out of 7. So, and these are women that genetically, if they would have been in Japan, they would have had a lower risk.
Just amazing. And, I also think, too, about having that good attitudes and overall good health and less stress, that also then affects, like you had mentioned, the caregiver for that cancer patient, the husband, the wife, even maybe an adult, child that's helping, their parent with, cancer and cancer treatment because, like you said, they've got that stress that they're undergoing. And then, of course, they're more at risk for.
It's a family affair, absolutely. And I think that for my my cancer patients, I always want to try to let themselves float. Don't push back, because what happens is that people are trying to help them, and they're in a very scared situation, and they start pushing people away. And likewise, the caregiver starts just giving up, because they just don't seem to be able to take care of someone that doesn't want to be taken care of.
And again, those local support groups and foundations that might be near, contact our clinic, and we'll be able to help, point you in a good direction if you do need some help and support in that area. I also want to just stress that, interviewing several of our patients for stories that, they explain and talk about their cancer journey, I can tell you that most of them, turned to God, and their faith actually what sustained them through their treatment. If you are of that nature, then that's a route to go as well. The importance of staying local for your health care, rural health care, doctor, talk a little bit about the importance of that.
Well, this is a perfect follow-up for the stress. You don't need more stress. And this is why rural health is, having everything available to you that could be available in a large city is going to be able to make you less stressed, because you're able to live in your home. You're able to take care of your children. You're able to take care of your husband, or you're able to take care of your wife. You can work. And most of the chemotherapy and radiation and so forth have now these days almost a pre-chemo treatments that will make your side effects less, so you will be able to really have very little. It will impact you much less. Radiation is almost never really harsh on anyone, and it only takes a few minutes. So imagine you're able to come in, get treated, go back to work, or pick up your kids. You're not going to be challenged in any way. So this is going to take less from your stress. But in addition, what's more important is that here we have really the equipment that would be seen anywhere in the highest equipment and the highest level of technology that you can have. It is very important to understand that, for instance, in chemotherapy world, the drugs or the immunotherapy are given by your weight and your height. The drugs are available here in MD Anderson, in Algoma, Wisconsin, in New York. They're the same drugs. So why would you go to, far away to receive the same drug based on your weight and your height? It is not a secret. It's not something, that is unique. There's not a black box that, where you get this magical medication. So the drugs that are available to everyone. Unless you're in a trial that is specific to that institution, we have the availability of getting that medication. And with radiation, the same thing. We have the expertise, we have the machinery, we have the availability to do all kinds of radiation techniques. And in fact, we're in Kansas, we're unique in that we have a PET-CT simulator dedicated to treatment of radiation patients. And what does that mean? It means that we don't have to fuse your images to treat you. So we're able to do the treatment live. And so it's like treating your hand versus your glove, okay? So if you had a cancer in your hand, but then I would treat it directly by seeing it, versus if I put a glove on top of it and kind of guessed where it was. It's a different, completely, yes, it may be close and may be exact, but it's not the same as being able to do it live.
I get that. I also just want to emphasize, too, just the importance of community. Some of the rural hospitals or that we've got clinics, located, and we work with that hospital, it builds that whole community, too. And it's just the somewhat cornerstone, I think, sometimes of those rural areas.
Absolutely. And also, you're able to work with a primary doctor, the surgeons of the region, and you're able to have that chart that is complete, that's not fractionated. You're able also to support the local hospital, and that's very important. You don't want to lose what you have in your community. You want to maintain, the local medical richness. You really are part of it, because you may need to come in at any moment of the day or night, and you need to have someone to take care of you.
Yep, exactly. I'm Leanne Powers, and I'm with Dr. Perez-Tamayo. We're from Central Care Cancer Center. This is Cancer Explained. So in talking again about overall health, why are people who use tobacco more likely to develop cancer?
Well, tobacco has been now completely recognized as a carcinogen. It's an irritant. It has certain components in it that are going to irritate your lining, whether it's your bronchial tree, your lung, your mouth, even your bladder, because when you go to the lung, it's like a sponge. So the smoke gets in the lung, these components go into your bloodstream and they go down into your bladder and the lining gets affected. It's like taking a sandpaper and starting scraping and scraping until you get cancer there. Now, there are some other cancers which are linked to tobacco, like, for instance, cervical cancer and breast cancer, but that's a little bit more nebulous. The absolute reality is that cancers of the head neck, meaning the tongue, the oral cavity, and that includes whether you smoke, whether you chew, whether you do this
vaping.
Mm-hmm. There is absolutely completely confirmed risk of a heightened tobacco. Now, you may have a lot of people that say that's absolutely bonkers. It's not true. But secondhand smoking is also, if you're a bartender, for instance, that has never smoked, you will have a heightened risk of cancer of the lung because you're smoking what is in your bar.
Okay, so now I'm going to ask you a personal opinion, and I'm just going to state that again. This is, your personal opinion, but when it comes to the use of marijuana, or medical marijuana, there's so many dispensaries that have popped up in different states and such, but help relieving a cancer patient's pain, treat nausea. What are your beliefs on that?
Well, it's not a belief. This has been around for many, many years. We've used it in the pediatric community since I started, so 35 years ago. It comes in a pill form and gummy or whatever. It's always been there. It is effective for control of nausea in particular. It is effective in many other situations. It can be an anti-inflammatory. It can also be a anti-anxiety. But again, just like anything, you can use it in the wrong way. You can use it unsupervised. Anything that is going to be, and you can use anything and make it bad.
Yeah, that's including, I was going to say the next follow-up for that is like our diets, what we eat. I mean, that could be the same thing for that matter, right?
Absolutely.
Yeah.
I mean, anything at all can become, a way to go to a path that is going to give you an irritation or inflammation. Actually, cancer is due to inflammatory process as aging. Aging is inflammation. You basically rust. That's what you're doing.
My body is rusting as
you are
I speak.
rusting.
Self-management is the main thing too. Take control of your health, make good choices, and then you're able to maybe be successful in beating that whole cancer thing. What are your thoughts on holistic cancer treatments, such as the use of like essential oils and stuff?
Well, anything that's going to give you calmness, less stress, that includes yoga, essential oils, anything that is, and vitamins, people, I'm a vitamin type of proponent. I think that people should be tested for being low in their vitamin D as in dog, or B's. I do think that the body is going to work better if you're not have issues. I see many people that are very badly, they don't eat well. They may be even overweight, but they are eating things that are superly processed, and they have glossitis, a sign of B insufficiency. They have anemia. That is because they just don't have their folic acid. And B12. There's a lot of malnourishment in the United States, even though we have plenty of food.
Acupuncture, I assume that's another way of just...
Acupuncture actually is covered by Medicare. It's actually excellent for nausea and other things. So acupuncture for pain control but we don't have the expertise in everywhere. Some people are very good at doing it, and if you have the person that can do it, it's actually covered by Medicare.
Is there life after cancer?
Absolutely. And this is actually... That's one of the hardest things. And my mother, who was an oncologist, went into psychiatry because of this. Integrating yourself into the community after cancer is hard. You are no longer the same, maybe in a better way. You have a different perspective of life. You maybe cherish it more, or maybe you don't. You see things maybe with more brilliant, more colorful, or you may be one that has really become very depressed with the entire process. So integrating yourself back is almost as important as fighting through the cancer.
Let's get into financial. Why are cancer drugs and treatments so expensive?
Well, they're expensive because they take a lot of money to develop, and I know that many people say, well, gosh, if I bought this in Canada or I bought this in India, it would cost a fraction of the money. Well, that's because they have not paid for for all the pharmaceutical trials and efforts that they go through. In the United States, there's a lot of roadblocks, good ones, because there are checks and balances to bring the drugs to people when they are already approved and are safe. The safety aspect of the drug is what makes the cost high. And there goes a lot of money into this investigation. So, and pharmaceuticals are really very generous. We are extremely pleased with how they extend their availability of free drugs to patients that can't pay, or that are in the donut hole for the Medicare patients. So they are very, very generous with medications or vouchers. And we also, as you know, Leanne, have the availability of grants for patients that have some financial difficulties or don't have insurance. In fact, most of our patients that use our grants are Medicare patients. They are not covered.
It's just amazing. That was something else I wanted to stress upon, is that at each of our clinics with Central Care, we have financial counselors that work to assist our patients with their insurance and what financial responsibilities. And like you said, to try to find those private grants to assist with those costs that are associated with treatment. And then we also, like I said, have those contacts with local foundations or support groups that can help you, get gas cards if you need help, if you are traveling, short distance, or, even like wigs if you've lost your hair and that kind of thing. So definitely something to take advantage of.
Well, in many communities, Emporia is one of them, but also Garden City and others have houses or hotels that have a special rate for patients that are with cancer.
Yeah, that's great too. When it comes to preventing cancer, doctor, let's just lay it on the line. Regular prevention screenings, I guess. Pay attention to your body and changes.
Absolutely, but I don't think people take advantage of it. For instance, if you're a smoker, do you know that your insurance will cover yearly low-dose CT scan? So why don't you do it? I would say probably 99.9% of the smokers do not get a screening CT. Why? If you have a stage 1 cancer, is 95% curable, and while stage 3 is like 10%, and we find most of the cancers in stage 3. About 70% of the cancers are stage 3. About 10% are stage 1. When they're found, because of they're going through surgery and they found a chest X-ray that's abnormal. So why in the world would you not take advantage of the screening that is afforded to you by your insurance? Or for instance, you go and get a pelvic exam, you don't get a rectal exam. Why in the heck? If you don't have a rectal exam, your doctor cannot feel your ovaries, your tubes, or your uterus. And in addition, if you have rectal cancer, that can be checked at the same time. The same thing with prostate cancer. If you go and get your prostate check, you have a rectal exam, and you can feel the rectum, and you can feel your prostate and your rectum. So you have to have your screenings when they're due, your mammograms, your colonoscopies, your skin checks, and also you yourself need to be aware of your body, and your partner needs to be aware of your body. If you feel something that is abnormal, it just doesn't make sense to you, go get it checked.
Right, exactly. You are your best advocate, something definitely that you have highlighted and kind of reinforced, I think, in my mind too. Is there anything else that you wanted to add? I mean, as far as like when it comes to our different topics that we've discussed here on little misconceptions of cancer or cancer in general?
Well, I think that the misconceptions, there's many, but even things that are just curious topics, for instance, that you may hear your friends say, like, if someone gets opened up, their cancer spreads, things like this. I hear a lot of unusual things. Call even if it's something that has nothing to do with you, but you have a friend that is scared to have a surgery because they feel that if they get opened up, they're going to have a spread of cancer, or if you have questions about what kind of screening is necessary for your age and so forth, call us. We'll be more than happy to tell you what would be the recommendations.
800-592-5110 is the number to call. Thank you, Dr. Perez-Tamayo.
Thank you, Leanne.
Well, we appreciate you taking the time to listen to this special two-part discussion of Cancer Explained with Central Care Cancer Center. With facilities throughout rural Kansas and in Missouri, Central Care offers complete cancer care all under one roof, so there's no need to travel far for the best care. Whether you need radiation or chemotherapy, access to clinical trials and novel treatments, financial counseling or a second opinion, maybe even supportive services for yourself or your family, Central Care is here for you. You have a choice. Bringing that expert care to you is an important component in the success of your outcome. Being surrounded by your family, your friends, that can be the factor that elevates your treatment. Again, our phone number is 800-592-5110, or you can visit us online at cccancer.com. For Dr. Perez-Tamayo and all of our amazing providers and nurses, I'm Leanne Powers. Thank you for listening to Cancer Explained with Central Care Cancer Center.
You've been listening to Cancer Explained with Central Care Cancer Center, offering expert cancer care that's close to home. Central Care Cancer Center has clinics throughout Kansas and in Missouri. Central Care Cancer Center, online, cccancer.com.